So my name is Carlton Boyd. I'm a native of South Carolina, very rural areas in South Carolina. I moved to Columbia, South Carolina, which is the capital, as most of you know, a while back. And I've been here for a while. And work in healthcare. I've been in healthcare for several years now.
What do you think includes your self-care? What does self-care includes? What do you think?
I think it includes, pretty much your diet, your sleeping habits, the environment that you can control as much as you can, different stress levels, and kind of removing yourself from the environments that you can control that may have a negative impact on your mental health. That's what I would that's my definition of self-care. So as a leader, what your self-care, people are looking to you for directions, right? So if there is a situation at any time and you're neglecting your own self-care, eventually it's going to take a toll on you, and you're not going to be able to perform to the best of your ability. You may have a nervous breakdown. You may end up getting ill in the sense that, your immune system breaks down. And, when you're down, you can't help anybody to your best capacity, to your highest capacity. So eventually it's going to take a toll on people around you who are looking to you, or looking at your example, looking for leadership from you. So, you're shortchanging yourself, you're shortchanging people around you. And in terms, you're shortchanging, a system that you're working in. And believe it or not, at some point that becomes contagious because
well, my name is April Scott. I'm a psychologist here in South Carolina. I'm a native of Birmingham, Alabama, but I'm currently residing in Columbia, South Carolina. As Dr. Thompson said, I work at the University of South Carolina as the Associate Director of Mental Health Initiatives for the university. So my job responsibility is to promote a culture of positive mental health to the entire campus, to increase awareness of mental health and mental health resources, as well as suicide prevention. So when I think of self-care, I think of what does it take to fill up my well. So I often think, especially when you're in healthcare, especially in any type of helping profession, we are pouring out so much. And we are not that good at pouring back in. So I try to think of my self-care as anything that's pouring back into my cup or filling my well up. So whether that's silence, turning off my phone, leaving work on time, which I'm not good at, sitting and eating a meal without having a book or a phone. So anything that's restoring me to where I need to be my best self.
I think the unfortunate challenge for Black folk is that we are continuously inundated with stimuli that continuously re-traumatizes us.
Yeah.
And so each of us can respond in very different ways. Some of us are going to be despondent. Some of us are going to feel powerless. Some of those who have a little something say, I'm not going to be like those brothers and sisters over there. Mm-hmm. Some of us are going to feel so incapacitated and paralytic that we're just not going to move. And then you're going to have those folks who are going to speak up and charge the crowd. And, but at the end of the day, if these are just the same words.
Right.
These are the same words that we said last week, the week before, last year, 5 years ago, 4 years, 10 years. Ain't nothing changed. It's the same cyclical pattern that at this point in time has beget a response that is going to beget another response, that is going to beget another response, and we're not going to get anywhere. We're going to be in this continuous cycle. So self-care right now really means, let me take a step back and really evaluate, how I'm caring for myself and all of the information that I'm taking in. As a preacher, that your eye gates and your ear gates need to be guarded at all times.
Yeah.
Because we're influential.